Hey guys, welcome to the Provider Autonomy Podcast. I'm Dr. Masterson. I'm here with Dr. Hussein, and today we're talking about how providers can think differently about their medical careers, because we here at Provider Autonomy believe that the best leaders for their practice are themselves. So, Dr. Hussein, welcome to the podcast. Thanks so much for being here. Yeah, so, one of the things, it's the story between us, like we've gone to the same church now for 4 years. I knew of you, saw you around in scrubs. Everyone's like, hey, there's a doctor over there. I need to go say hello. Did not know we were such like-minded. So, tell us just for the listeners, a little bit of your story, kind of your background medically, and then what your journey's been outside of the healthcare or outside of practicing medicine.
Thanks. Great to be here. And so I think, starting off, I was a child of a physician. And so my father's the generation of a physician, 75 years old, still practicing, single coverage, takes 3, 4, 5 days a year off. And that's what I saw growing up. And so going into college, I thought there's absolutely no way I want to be a physician, right? That just doesn't seem like the life I want. However, loved healthcare. And so that led me into medical school, and I have 3 other siblings that are physicians. And so one thing that I realized pretty early on was that I loved healthcare, but I probably had maybe a little bit of a view of how I wanted to affect the world in a bigger way, if you will, other than just one patient at a time. And so I always had this desire to change healthcare, worldwide, countrywide, citywide. And so as I continued to go through the process, decided to do emergency medicine and continued to work in that world. I just felt like to be the most complete person, the most complete physician, is I really needed to understand and get a good handle on all the different facets of healthcare. I mean, if you didn't know, I'll inform you that the healthcare landscape in America is complex and deep and diverse and not understood well and all of the things. And so dipped my toe a little bit into understanding the nuance of staffing and the nuance of operations inside of a hospital, inside of our health systems. Ended up starting a company from the ground up to help assist organizations with staffing and then ultimately contract management for inpatient services. And then that led me to a place where I realized I had a deficiency in the understanding of how the payer works and how that whole arrangement works between the patient and the payer and the health system of sorts. And so worked in that for a few years. And now I'm working in health tech as the CMO of Point Click Care. And really the way I got into that is this is sort of a current landing spot as I see it for a position where I really feel like I can affect significant, substantive, countrywide change in how we effectively deliver healthcare.
Yeah, I couldn't agree with you more. I think the first step in affecting change in our healthcare landscape is physicians getting involved in the administration of healthcare. And we do it so pragmatically right now in the sense of I'm just going to prescribe the right diagnosis or the right treatment or what have you. But the truth is, not only do we need to do that, but we need to also be a part of how it's delivered or what is delivered, not just the why. And so a lot of physicians, providers, practitioners, pharmacists, PT people often shy away because of what you said in the beginning, right? It's very complex. So from your own story, how did you overcome that fear of complexity? Where do I even start?
Yeah, I mean, I think part of it comes with failure initially. I mean, I left out a story of trying to start a company, a school telehealth platform, probably 4 or 5 years before its time, and failed and realized that those stories about being able to conquer the world, you realize quickly you need a team, you need people, you need help, you need expertise. And so I think you just got to keep picking yourself up by the bootstraps. When students go to medical school and they go into residency and things of that nature, I often hear like doubt in their voice sometimes about, man, I hope I can cut the mustard to make it through medical school. And what I share with them all the time is like, remember, the system is set up for you to succeed. The system is set up for you, for everybody to go through, do the work, do your best. And in reality, that the system is set up for you to succeed. The desire is not to fail people at that level. But what happens is after we get out of medical school, we feel all the pressures of life that come to us, whether it's student loan to repay student loans, maybe starting a family, where do I want to live, what does buying a house look like? And so there's all these complexities of life that hit us, and the temptation is to be like, hey, I've just got to figure out how to deal with life, and my job that I call being a physician, I can't be learning about this and that. And so, but for me, it was maybe a little bit of ADHD of sorts. I tended to get bored in what I was doing. And the moment that I felt that it was wash, rinse, and repeat, I felt like there was a moment of necessity to innovate personally. And, where that took me, time will tell.
Yeah. So it's interesting you say once it felt like wash, rinse, repeat, because I do hear after I'm a practicing physician, I'm in my practice, 4 or 5 years under my belt, then is when I'll do X, Y, Z. Would you give that advice to a resident, a medical student, even to yourself at the age?
Yeah, I think that there's probably a sweet spot in there, in my opinion. I think in order to have the understanding that's necessary to pursue maybe an alternative career or a byproduct of a career in something other than maybe your craft that you're trained in as a physician, I think there's a sweet spot in there. I mean, it's easy for me to say as an ER doctor because I can go get a job for 2 years and then step back. But if I was a surgeon or of sorts that we're building a practice, it's quite easy to be like, I'm going to do this for 2 years and then step back. So, but I don't think the time. I think we underestimate the brilliance of the young mind.
Amen.
And there's such a value because, I would argue that when we started this company, Sycamore Independent Physicians, and even to this day, we oftentimes look for people with no experience. And the reason is because we're trying to do something new and innovative. And what we don't need minds and thought leaders that come from the industry that bring the same old thinking. Right. Because it's really hard to undo thinking, or it's a lot harder to undo thinking than it is to take a mind that of someone who has the desire, the passion, the motivation to learn something and mold them. So it's the young mind is an incredible asset.
Yeah, I couldn't agree with you more. I mean, I would be hesitant to tell someone go out and start something or join a practice or start with a hospital and get comfortable, and a lot of times just because of the things you mentioned, we get families, spouses, kids, they get attached to social infrastructure, and you get, 3 years becomes 5 years, 5 years becomes 10 years, 10 years becomes 15 years, and now you're like, oh, now it's the time to me to go start this thing or try this thing, and it's not the competency that you're lacking, it's the ability or the bandwidth because you've committed to so many other things. And I think that's so beautiful. We so often underestimate ourselves as physicians and providers and our ability to achieve, because you're right, like people get into medical school and their first thought is, I'm not going to make it. And then we apply that same logic to like the practice of medicine. Oh, I can't start my own practice. I wouldn't even know where to begin. And I often encourage people, like, if you can get through medical school, if you can get through the USMLE, then you can get through starting your own business. Yep. Where do you think that complex comes from?
Yeah, I think that there's a ever growing feeling that this business of medicine, sort of in quotes, I will put it, is not the purview of the physician. And I honestly, I just couldn't disagree more. I understand that there's valuable degrees and MBAs and healthcare administrative degrees, and those bring value, especially in our complex system. But if I look back at my career, I would say that the biggest, most valuable moves that I ever made was just to get my hands dirty, was to
Right.
jump into a situation where I knew nothing about,
Exactly.
jump into it with humility,
Right.
but jump into it. And when I'm out of that situation, be all the better for it. And so I think that I think the idea of starting your own practice, of creating your own lifestyle, of prioritizing what is most important to you. I think at the end of the day that you know, when we look at the workforce, if we look at this from a more holistic, less introspective but more like holistic point of view, the value is how do I keep doing what I'm doing, or how do I keep working and contributing to the improvement of health and care in the patients that we serve, whether it's locally or nationally or what have you, for as long as I possibly can do it. And the reality is that the way that we have created healthcare in America today for the physician that leaves medical school and into residency, that's not really much, there's not much thought put into that.
Right.
And so if you can create a scenario in private practice or through a you know, maybe an amalgam of different types of careers, a clinical career and a non-clinical career, and maybe a more philanthropic, like however you want to put it together. But if that's something that creates lifelong happiness and you can be able to do that for many, many years, I think that's what a truly successful, integrated, physician-led healthcare team looks like.
No, I agree with you, because the more that you become duplicitous in your approach, the more impact potential that you have, and impact is really what leads to meaning. And I think there's a huge void. So many healthcare professionals go into medicine in search of meaning, and we do it in the sense of like, hey, if I can help someone, that's going to give me this sense of purpose, this sense of meaning. And then we get into it, and then we get overwhelmed by the bureaucracy of medicine, and it's like, what happened to the meaning? And that's the nurses, that's the phlebotomists, that's the pharmacists who are just in the everyday rigmarole, to use a really poor term, but that are just stuck. And I often wonder, like, how do we get them to that place where you're talking about, just like being willing to fail, because we're so terrified of it in our healthcare system. You know, I totally agree with everything you just said, but I am going to ask kind of the countervailing argument, which is, if that's true, and physicians and the young mind is really beautiful and has all this potential, and there's all this ability to create this amalgam of a career for impact, why is there the innuendo or the, I guess, the judgment that physicians are just such bad business people?
Yeah, I mean, I think that it's funny, because I think that part of it is the way we think, right? Like in medical school, when you think of the scientific method, you think of like, well, you have to have a theory, and then if you have a theory, you really can't say that it's true until you prove it's true. And so when you think of like a lot of the business dealings that you've had and I've had, there's no like guarantee, you know, there's no guarantee return when you say, hey, I'm going to start a practice and buy this building and build it right here, and we're going to do it this way differently, and I'm going to have all this staff, and we're going to invest in people. And you say, well, that's great, but that could fail. And you're like, yeah, that could fail. And so when we think of the scientific method, and we think of what we talk about, how we learn in medical school, is it's not done until it's done. It's not done until there's research that's prospective, blinded research that says, hey, it's done. And so so much of being a good, prudent business person is doing research, is doing your homework, but also taking risk. I mean, and oftentimes if you wait until it's a done deal, it's sort of too late. You know, it's like, you know, if you bought the Airbnb 8 years ago, you'd have done pretty well. But if you waited till today, you might have an anchor that is undesirable.
Yeah, no, I think you're right. I think a lot of times it's people that even with just really high intellect, you know, medicine and sciences really attract people with high intellect, and they often want to be able to figure out every problem to its conclusion, because that's how they've lived their lives up to this point. And often it's the risk adverse that don't do as well in business than the risk tolerant, because they're willing to take that step. You know, and if you fail, you learn. If you win, you succeed. So I think that's really, really interesting. So curious though, do your siblings practice medicine the same way you do?
So no. In fact, I'm probably the only. Well, let me take a step back. Two of my siblings are still in residency.
Okay,
So
got it.
time will tell with them. But my brother, who's 15 months younger than I am, he's a hospitalist and infectious disease physician. He is not like me when it comes to this.
Sure.
He is very much about like if he needs to make more, he works more, and if he he works for a health system, and so he doesn't have that desire for risk. I heard somebody once say it also this way is that if I have to bet on somebody, if I have to bet on something, why not bet on myself, right? And I not that I'm going to be undefeated or not that I'm never going to lose, but I'd rather bet on me to be able to see whatever we're going to see through.
I totally agree.
And the good, the bad, the ugly, rather than having to depend on something else. So, anyways, it's my father doesn't see it like I do,
I bet,
and neither do my siblings yet. So.
Yeah, it's interesting. I often tell people that are interested in private practice, when you step out into practice, and the caveat to this statement is it's those who argue against private practice because they think it's going to be a headache. I say, well, I promise you, if you start that hospital employed job or you start that large conglomerate group job, it's going to be a headache. The headache's going to either be caused by someone else or it's going to be caused by you.
Right.
Which one would you rather choose? Like every time I go home and I'm like, ugh, in the back of my mind, I'm like, you know whose fault this is? It's my fault. And if I would have done something differently, which is a lot more honestly freeing than you think. It's a lot more freeing than to be mad at yourself than to be upset with somebody else.
Yep.
You're like, gosh, I wish I made a different decision. So I think that's really interesting the way we look at that. So a lot of physicians, probably similar maybe to your dad and your brother, kind of have this, Jim Collins calls it the tyranny of the or. Which is I can either be focused on the metrics or I can be focused on medicine. I can be focused on profits or I can be focused on patients. And I think one of the things I've tried to dismantle for thinkers like that is, Collins calls it really, it's the freedom of the and. Like you can be both. What are your thoughts on that? What are conversations around that idea kind of being almost exclusively in the business side now, outside of the healthcare side, that you've had around that topic or idea?
Yeah, I think you're exactly right. I think so often we want to talk about them as or, right? And the reality is that there's a component of this that's not, creating trinkets, right? It's not we're not making widgets, right? There's a relational component that exists here. And so when we talk about making profit and we talk about providing care, the reality is they do coexist, and the reason they coexist is because of that relationship, that relationship component, right? And so, my father used to always tell me, he'd say, "Hey, listen, if you treat people right and you do things well, to the best of your ability, you're going to make money in this world in medicine. Like right. it's not overly complex, although we try to make it that. The reality is that profit is the outcome of good work, right? It's the outcome of doing a lot of work. It's the outcome of doing good work. It's the outcome of creating a good team. And so we shouldn't be afraid to say, hey, this office or this hospital makes a lot of money. Like they clearly must be doing something right. I know that's not the popular opinion of in a lot of places these days, but that's the reality, is that profit can come with expertise. Profit can come with doing great work. That's really the output. And so oftentimes the feeling is that you must be making a lot of profit because you're withholding something from providing care. You're not providing. And so I couldn't agree more that these things can be profit and providing great care can be and they're not mutually exclusive for sure.
For sure. Yeah. Well, thanks so much for being on.
Yep.
I can't tell you how much I appreciate it. I always kind of like to let you speak from your heart for just a second, because, we share a passion that is kind of a minority in the healthcare industry. So if you were to, have like 60 seconds to talk to that provider who's like, gosh, I think I might want to start this business, or I think I might want to go out on my own, or maybe that resident that should I do private practice? Should I do the group thing? Should I do the hospital employed thing? What would be your encouragement to them?
Yeah, I would say, I share this with my kids as well. It's, live today. the effects of medical school and college and sort of this institutionalization that we have that is healthcare causes us to always look towards the next thing. And so, if today you want to consider private practice, go into private practice.
Yeah.
And the last thing I'll say about that is that you have a degree and you have an ability that cannot be taken away from you. So
Right.
you will not succeed at everything you do in life. None of us will. But the reality is you have something to fall back on. God
Right.
forbid that happened. And so, I would say that the worst thing for me personally, from a career standpoint, is if I got to the end of my career and I said, with multiple things, shoulda, coulda, woulda. And I would encourage you, as a 28-year-old graduate of medical school, to not hit 30 or even 40 and say, shoulda, coulda, woulda.
Yeah.
Just go do it.
Right. That's good. Well, thanks for joining us here on Provider Autonomy Podcast. We believe that providers are the best leaders for their practice. We'll see you next time.